Hi, everybody. It's Elle. Today, we're going to be talking about what my top barriers to implementing a postpartum occupational therapy program is. And by far and away, the top barrier is interdisciplinary interactions. So, I have found that other people on the team don't quite understand the role of occupational therapy in general, and then more specifically as it relates to postpartum care. In fact, many people have no idea that occupational therapists actually have mental health training and that we are mental health care providers. So they think that when an occupational therapist wants to go in with a patient, that we're going to be doing rehab therapy. So getting them up, having them walk around, do weights, go to the gym, something like that, even showering with them, which I do think there's a place for us to do ADL training, which is activities of daily living, and that's things like taking care of your body. But what they don't quite understand is that my focus is different. It's more consulting. So I'm going in, I'm chatting with parents, I'm screening them for various mental health issues, and I'm giving them some preventative ideas on how they can approach their own mental health in the postpartum period. So the barrier is that I will, as a courtesy, speak to nursing staff before I go see a mom, which is a courtesy. It's not a requirement that therapists speak to nursing staff, at least not the facility that I'm at, and generally it's not, as we do have a graduate level education in healthcare. So, for example, many of us have doctorates, and we learn lab values, we learn vitals, and we learn all of those things when it's appropriate to work with a patient and when it's not. So when we speak with nursing staff before we go in, generally it's a sign of respect. Um, but unfortunately, nursing staff sometimes misunderstands and they think that we're asking permission to work with patients. And so you'll hear from other therapists times when there has been butting heads because nursing staff has told therapists they can't work with patients. And that's not really the way the power structure works. So it's just one of those team dynamic things that kind of needs to be figured out. And I have found that the primary problem is a lack of education on our roles and a lack of education um, on what it is, the type of training that therapists have, especially occupational therapists. And nursing staff doesn't necessarily know what it is that we're trained on, what we do, and how we interact with clients, and why we do what we do. So much of occupational therapy is prevention. We're trying to prevent, overuse of various joints and getting injuries. We're trying to prevent depression and PTSD and anxiety. We're trying to prevent coming back to the hospital. We're trying to prevent injury at home because maybe they fall while they're in the shower. So it's very important that we do see clients. In fact, in a 2016 study, and I will link below, that in that study, it actually showed that occupational therapy was the only healthcare profession that when more money was put into that department or into that profession, that there were fewer incidences of readmission. And that was confined to 4 different diagnoses, I believe. So we do have a lot of value. However, not everybody is as well educated on our value. And that's something that as a profession we need to work on. So I would say my top barrier is nursing staff understanding the role of occupational therapy in general, and more specifically, my role in mental health care. And this is something that, I do education one-on-one several times with nursing staff, and it will be multiple times with same nursing staff. And unfortunately, because they don't have that base and understanding our approach and what we do and outcomes related to occupational therapy, it doesn't quite click. So I do run into that quite a bit when I will go to work with mothers, and nursing staff will tell me no. Um, And that is when that happens, there's a decision therapists have to make. And there's no right or wrong, it's just your personality and your approach. So you can either say, well, this is my patient, and so let me check their lab values and their vitals. And if that's good, I'm going to go see the patient. Or you can say, okay, well, I need to see them by this time. When can I come back? Or you can just say, okay, and then move on about your day. And it's really just a personality thing. For me personally, my approach is more win them over, right? Trying to get other staff members to trust me and to have a good working relationship. And so, what I will typically do is just say, okay, I'll come back later. Or I will say, when's a better time? I need to see the patient by this time. And I try to work within that structure. However, when you have a limited amount of time to work with patients, I have 6 hours. So I need to see moms within 6 hours of giving birth. That makes it very complicated, particularly when labor and delivery keeps moms um, for long periods of time. Sometimes they can keep them up to 5 hours. I've seen even 7 hours, 8 hours. Typically, it's a couple of hours, but it just varies and it depends on when the baby's born and when shift change occurs. So, it might be a mom comes in for an hour, or excuse me, after 5 hours being in labor and delivery, and, she has 1 hour left in postpartum care, and I have a very short window. Unfortunately, nursing staff will think, like, okay, well, mom just got here, so she needs to settle in. Or something that I get a lot is, well, mom had a really difficult labor and delivery, and so she needs to rest. And it's very hard because I understand that if mom had a very difficult labor, there is a high chance that she had a traumatic birthing experience and she's at risk of developing postpartum PTSD, in which case the worst thing she could do is sleep. Because when you sleep, that's when your short-term memories consolidate into long-term memories. So in that period, we want to catch moms and interrupt that consolidation of the traumatic memories from short-term to long-term. And it's very vital. And so it's difficult to try to explain to nursing staff that actually the worst thing mom could do right now is sleep before I work with her. The best thing is let's do, 15, 20 minutes, very quick intervention, and then mom can rest. And I can finish the rest of my consultation when she's better rested. That's something that I still have not had success with nursing staff after 2, 3 months. So it's trying to chip away at that. And I think someone else with a different personality might approach it differently. But I am of the opinion that there needs to be more education for nursing staff in school just about what it is that occupational therapists do. And I don't mean to pick on nursing staff because I see this with other healthcare professions as well. Even our best friends, like physical therapists, don't necessarily know the type of training that occupational therapists have. And there is this difficulty in understanding what we do. And so I really, even beyond nursing staff, I believe that as a profession, occupational therapy needs to push for occupational science to be an option in every 4 year program, every undergraduate college program. So have it be an option along with psychology, sociology, criminal justice, economics, whatever it is that that school requires, have that be one of the options for a better understanding of what occupation is in general, right? Like, what is occupation? And a lot of people assume that means a career or a job that you work for and get paid. Um, and that's not necessarily what it is. Occupation is any meaningful thing that occupies your time. So it's one of those difficult things because there is a lack of understanding of what we do. So much of what occupational therapists do is they take their time, their precious time, trying to educate and re educate and educate again and re educate again. And unfortunately, that takes away from the client and the treatment time that they're getting and what it is, addressing what it is that they need to have addressed. So I'm of the belief system that big picture, occupational science needs to be taught in every undergraduate program. I'm also of the opinion that every healthcare program, occupational therapy included, needs to learn what the role of every profession is, and they need to learn um, the benefit of the other professions and to respect them and understand we have different roles, but we're all working together for one common goal. And one's not more important than the other, that it's about understanding and respecting what each other do and working together as a team and trying to understand. Having those active listening strategies where you're listening to understand, and it's best if we can all do that. So I'm zooming in more. So we were zoomed out. Now we're zooming in. Um, I also think that for any occupational therapy emerging practice area, it needs to start with education for the other professionals that you'll be working with. And it's tricky in a hospital setting, especially for nursing staff, where they work 312s and they'll go through different departments depending on the need. And so there'll be a lot of faces in and out. I would say every day there's a nurse in postpartum care that I've never seen before, even after 2 months. So that's one of those things that how do you provide education in that situation? And I think probably maybe having videos, having CEUs, having webinars, having things that they need to do that's required, just so there's this basic understanding of what we're doing. So if I were to build a program, again, I would start first with education. And that is something that I did want to do. I do have podcasts that are going to be recorded, and I want to offer them as CU credits. However, there are other time demands and that take precedence over that. But if I were starting all over again, that is something that I would do as preparation, even if it was just like one training video or podcast talking about the general thing that we're doing. And I would go to managers, management of nursing for that department, and I would ask that they have nursing staff watch the video and take like a quick CU quiz or something like that. So we're all on the same page. And I think that moms would benefit from that. So if I had to say what my top barrier to effective treatment of moms in postpartum is, that interdisciplinary barrier of other staff really not understanding what it is that occupational therapists do in general and what we're doing in postpartum care. And even though it's, reiterated, it doesn't quite catch. And there is also this education piece on, for me specifically, I need to see moms within 6 hours and how important that is. And it's trying to balance, do moms physiologically need something else? If they have a fever, then by all means, they need to rest. If they are at risk for hemorrhaging and whatever, they may need to rest. But having kind of a blanket, no, mom had a difficult birth, and so I don't want anyone to see her. And I get that there is this honest intent to try to protect mom's mental health and her attachment with a new baby and relationships, but it's a little bit misguided because this is something that's been heavily researched. And this is something that occupational therapists have expertise in when it comes to mental health. We are mental health care providers. And that's not to say that, we know more than psychologists or psychiatrists, because that's nowhere near true. But we are mental health care practitioners that have education at a graduate level. So there is this deep understanding of what it is that is going to benefit moms when it comes to mental health. And perhaps nursing staff does not have that training but they don't understand that occupational therapists do. And so there's not quite that interdisciplinary um, team aspect or respect for what it is that the other profession is doing. And I just want to reiterate, I think that it's done in good faith. I don't think that anyone's trying to be punitive or be exclusionary or, any kind of drama or anything like that. It's more so just a lack of interdisciplinary education. So, again, I will say this again. If you are trying to start a program at your hospital where occupational therapists come in, start first with education. If you are a school are sending several students to a hospital for their capstone project, and perhaps they all have an interest in postpartum care or maternal care or women's health in general, I would suggest a team approach to where one person is responsible for perhaps creating a website, and then another person is responsible for doing podcasts or training videos, and then another person is responsible for treating moms. So a several student approach so you can cover all of the bases effectively. So I think that with all of those things covered, we could have an amazing relationship with nursing staff in postpartum care, just as we have amazing relationships with nursing staff in other settings. For example, I've co-treated with nurses in the subacute setting several times, and it was a wonderful experience. I felt like we exceeded interdisciplinary care and we went to that transdisciplinary arena. So we have so much in common and we can complement so much, we can complement one another. It's just about understanding where each other are coming from and trying to work together so we can all get our goals met. All right. Thanks, guys. Good luck. Bye.